Well, thank you for having me. Gosh, it's been a while, right? Since COVID. So it's really wonderful to be here in person, and to see everybody's faces. For me, working with patients is what it's all about. Love the educational piece too. So I get pretty fired up about this. So I'm excited to be here. So I'm a naturopathic doctor. So maybe show of hands who's familiar with naturopathic medicine. Okay. So just a little bit about, so the FABNO at the end of my name is a fellow of the American Board of Naturopathic Oncology. So I was trained as a naturopathic doctor, but I did extra residency and the board exam specific to oncology. So this is something I've been working with for 20 years. It is always changing. I love learning about it. So really excited to share with you today. I have a private practice in Atascadero, but I do a lot of especially after COVID. But I see patients all over, so I get an opportunity to work with different oncologists. And I used to work with Cancer Treatment Centers of America, a large-scale integrated hospital. So I'm very familiar with both the conventional and natural side of things. For me, I really see myself as an advocate. So it's not that one is better than the other. Why not combine the two to really get a lot of synergy and benefit for patients? So that's my goal. Whatever is the best tool at the time for patients. All right, so let's get started. So the immune system and the microbiome. So this is a topic that is really, I would say, exploded in the last 5 to 10 years, and we're still learning about it all the time. So it's something, what we'll talk about today is really what we know now, but stay tuned because there's a lot of information that's coming out too. Before we get into some of that detail, I like to set the tone for some of this information and for what it really means to heal. So this idea of a personal ecosystem. So how do we choose to take care of our body every day? We're not just a liver or a kidney or a breast or a colon or a prostate. We are a whole person and we are an ecosystem. So the things that we choose to do every day are going to either nourish or deplete the system. And the things we'll talk about today: breath, food, water, movement. So we get started with that. I invite everyone to close your eyes and put your pens down for a moment and have your feet flat on the ground. If your hands are crossed, uncross your hands and settle into the present moment. You don't need to change your breath right now. Just check in. Is it fast or slow? Is it shallow or deep? Just see where you are. And then on the next inhalation, inhale, belly out. Relax your shoulders. Exhale, belly down. Elongate your spine. Feel your seat on the chair, chest, heart center open. And again, inhale, belly out. Exhale, belly. And then do this 2 more times at your own breath space. There's no right or wrong way to do it. It's however it feels good to your body. And on the exhale, release anything that doesn't serve you in the present. And then when you're ready, open your eyes. So now that we're all here together and our immune system just got a big boost from that breath, we're ready to take in some good information. So where do you start? I like to get the lay of the land. So we'll talk about the immune system, what it is, what aspect of it we're going to go through, the microbiome, how can we support it with food and nutrition, diversity in one's diet, herbs, and botanical support. At the end, there's a few recipes, and you'll all get a PDF of this, so don't feel like you have to take notes frantically. You'll get a copy of it. And then there's research and resources as well. So the immune system. Okay, so we have these organs of the immune system: lymph nodes, spleen, appendix, Peyer's patches, bone marrow. What we're really going to talk about today is the seat of the immune system, which is our gut microbiome. What does the immune system do? Most of the time we think of it as defending against infection. It protects the body's own cells. It has an amazing memory of every microorganism. What I think is most striking, and what we really want to talk about today, is 70 to 80% of immune cells are in the gut. Everybody always says, I want to stimulate my immune system, I'm going to do things for my lymph nodes, really? Most of it is in the gut. So that's where we're gonna go today. What kind of cells are we talking about here? We have two aspects of our immune system: innate and adaptive. These are the cells that are present in both of those aspects. I highlighted the dendritic cell there. These are all the different types of immune cells that are active, that go after abnormal cells, so go after cancer cells. Dendritic cells are particularly active in the gut. They're antigen-presenting cells. And so those will be some that we're talking about as well. There's also T and B lymphocytes. Lymphocytes, of course, a lot of you know, I'm sure, from the CDC that you see with treatment. But these are the cells we're talking about. So microbiome. So what definition of microbiome? So this is the microbiome, are all the microorganisms that live in or on the human body. It includes bacteria, virus, fungi, yeast, parasites, and archaea. The gut microbiome, there's actually a biome in various parts of our body, but tonight we're going to be talking about the gut microbiome. The microbiota, those are the actual bugs. So just a little definition there and clarification. So if you look at the image of the microbiome, look at all the different aspects of the body that are affected by the health of the microbiome. So we'll be talking about the immune system today. So you think, how is it that my gut bacteria has anything to do with cancer, whether it's stimulated or inhibited? Essentially, the bugs in the gut secrete or exude or transfer metabolites that then go into the blood, and these are immune messengers. So the health of the microbiome, whether it's in balance or not, will send different messages to the rest of the body. So by focusing on the gut, we're actually focusing on the whole ecosystem. So when you have balance in the system, you have solid immune function, good digestive function, meaning you're absorbing nutrients. A real key element in research right now is the gut-brain axis. So that's neurologic function, respiratory function, metabolic. Just read a study about the microbiome and certain parameters that can dictate weight loss or gain. Who knows? Maybe at some point we'll be given a particular bacterial soup in order to treat different diseases. Right now, we're not there. And we'll be focusing mostly on food and herbs tonight, but it's coming along. And of course, skin effects. In traditional naturopathic medicine, when anybody has any skin issues, first thing they say is treat the gut. So what do we want to avoid? Imbalances here. When there's imbalance in gut bacteria, there's increase in inflammation and decreased vitamin and mineral absorption. It can affect our hormone levels. This becomes incredibly important, especially in estrogen positive diseases. So we really look at this around breast cancer, we look at it around prostate as well. What causes dysbiosis? I don't know dysbiosis, that doesn't sound very good, right? So many things, you know, medications, taking too many probiotics or the wrong probiotic, alcohol, where you live, hygiene, too much hygiene, not enough hygiene, chemotherapy, radiation, stress. So we could be, you know, crossing all of our T's with super stressed mode, and that could create an issue too. So really thinking of it again as this ecosystem and the choices that we make. I think we covered all of them here. Food sensitivities, I like to call out as well. And excess of animal products can be inflammatory to the gut. Sedentary lifestyle and pesticide and herbicides in our food, higher concentrations. So all these things can contribute to that dysbiosis. So let's look a little bit at the immune activation. Just I like to look at a visual to understand really what's happening. It's a little more of, so here you can see this is the lining of the GI tract. That's that dendritic cell I pointed out at the beginning. And then these messages can either be immune activating or immune suppressing. So that's the detail. That's how it can affect things. I wrote down for you the list of neurotransmitters as well. This is really more related to the gut-brain axis, but I think it's crucial. Most of the serotonin is made in the gut. So we're also talking about mood and neurological health as well. So how do we heal? How do we heal? For tonight, we're really going to be talking about nutrition, what we eat and how that can affect our gut. It's a little intestinal villi there. And then how that gut flora then makes short-chain fatty acids. Short-chain fatty acids we'll talk about in detail. But they're really messengers to the immune system. And depending on what we eat, AKA fiber, so I'm saying that because it's your friend for life. When we eat more fiber, our gut bacteria make more short-chain fatty acids, and these are the messengers that can prevent a lot of human disease. And for tonight, definitely talking about the anti-cancer properties of that. So fiber. So what happens? We ingest fiber from the foods that we eat. These are prebiotics. So when you talk about what foods are prebiotic, what foods are probiotic, and what is a postbiotic, okay? So prebiotics are the fibers that you eat, and then that then is fermented by bacteria. It's the probiotic, the live microorganisms, so the probiotics. And then the postbiotics are, what are those bugs making? Short-chain fatty acids. So you can see how there is a direct line from what we're eating to what then is produced as a messenger to the rest of the body. Here's just a list of, okay, so how much fiber do we really need to eat here? The aim is at least 30 grams a day. So here's just a nice list to sort of understand, okay, what are we really talking about here food-wise? And when you look at this, you think, okay, I could get there. You know, there's some definite foods like legumes that we'll talk about in a little bit. They're a little more heavy hitters with fiber. For example, black beans have 15 grams versus romaine lettuce has 1. So sometimes you know, doing a little bit of math there helps you to eat a little more of certain things and maybe not as much from others. Really important. When people increase fiber in their diet, you have to increase water intake. So fiber is a binder. So a lot of times people come into my practice and say, I'm eating all these great foods. Why am I constipated? Because fiber is a binder. It's going to bind up whatever's there, and it can be very cloying. So you have to increase hydration when you're making those diet changes. As a side benefit, when you are well hydrated, You will have improved lymphatic flow, improved removal of waste. And on the negative end, if you're not hydrated enough, if you're dehydrated, there is a direct increase in gut lining inflammation. And that is not beneficial for that balance in the microbiome. The other aspect of this too, and this is just, I just was looking at a study for a talk I gave last week on lymphedema. When you're dehydrated, lymph fluid concentrates, and it will actually worsen lymphedema and worsen the potential for lymphedema. So big, important point here for that as well. What's the recommendation? Half your body weight in ounces. I always put this includes herbal tea, does not include caffeinated beverages or sodas, but shoot for that roughly. If you get close to it, great. You don't have to go over, right? If you're a big exerciser or a big sweater, I would say a little more after you exercise. Sweating is good. It's a good detox pathway. So let's talk a little more about these short chain fatty acids. They sound like something that's very important in terms of the messenger for the immune system. So they're stimulated by fiber intake. They are created by fermentation by bacteria in the gut, and these help to regulate the immune system. They decrease inflammation. They also decrease allergic response. So these are some of the potential messages to the body that you can get from those short chain fatty acids. What is very striking to me is that this microbiota, so what your particular breakdown of gut bacteria can increase or decrease our immune response to tumors. Specific short chain fatty acids, the one that we'll focus on and the one that a lot of the research focuses on as well is butyrate. Butyrate in higher levels, and we'll get into, some people do like to test the specifics of the microbiome. You can test your butyrate levels, so it's your test. But butyrate can regulate cytotoxic T cells. So those are cells that can directly go after cancer cells, T helper cells, B cells, and mast cells. So these are mechanisms, ways that the butyrate communicates with the body in the bloodstream. So how do we get more of that? How do we get more of those short chain fatty acids? One of the things that can be very helpful and can be good fuel for the gut bacteria is something called resistant starch. You can increase the resistant starch in a lot of these if you let them cool overnight. So a good example of this is, say you make your oatmeal in the morning, you eat a little bit of it, and then you put the rest of it in the fridge, and maybe you eat the rest the next morning with some brown flax seeds, pecans, walnuts, sunflower seeds, and blueberries. Not by itself. A little too high glycemic on that one. And then we'll get into a little bit more detail about which vegetables, which fruits, nuts, and seeds, things like that. But essentially, we are what our gut bugs eat. You know that saying, you are what you eat. We really essentially are, what are we fueling these gut bacteria? So what are some of the good things we can take specifically? So leafy greens, cruciferous veggies, sprouts, nuts and seeds. They're also full of anti-inflammatory fats. Good spices, garlic, ginger, and turmeric. These things also help with circulation. Turmeric has also been shown to decrease pathogenic bacteria. And these are great to do as a food. You don't have to take it as a supplement. Just go get some nice organic turmeric root, slice it up. You can grate it in a soup. I like to put a little slice in my teacup. Just don't use, your favorite teacup that might stain, or if you use organic turmeric powder with your favorite ingredients, do not do that. It is very strong and stains. I've gotten in trouble with patients on that one. Berries, full of bioflavonoids, good vascular support, anti-inflammatory, lots of colorful veggies. Again, full of bioflavonoids, and we'll get into a little more detail about what those are too. So you're kind of hearing it's good to eat a lot of fiber. And we just talked about veggies and nuts and seeds. So am I advocating a plant-based diet. I'm advocating for mostly plant-based if we're talking about supporting the microbiome. That doesn't mean that you can't eat animal products, but if you do eat animal products, only 1/4 of the plate, and whenever possible, organic, pasture-raised, and hormone-free. This is important. People always ask me these questions. It's really important to keep that up. Yes, yes, it is. We just spent the last 6 months researching a talk for naturopathic physicians, and I really got granular on, okay, what is it about this pesticide herbicide residue? And one of the things I discovered that it was toxic to the microbiome. So if you're going to split a hair, this is the one I recommend. And the great thing about this is that means less pesticides and herbicides in the environment, which means less carcinogen in the environment, less mutations in our cells, and it just goes on. So there's my soapbox. I'll hop off that right now. Fruit is good. I always like fruit in terms of balance, 1 to 2 servings a day with protein and fat. This fruit tends to be higher glycemic, but it's very healthful. I like the plate to look something like this, just in terms of half the plate veggies. Nuts and seeds are in there too. Healthy fats are extremely important. The main thing about fats, and we'll talk about olive oil in a bit, the main thing about fats is that they can be the fats that we eat dictate inflammation in the body. So if we're eating inflammatory fats, there's more inflammation in that. So making sure that we're doing good quality anti-inflammatory plant-based fats, or if you're eating animal products, just in terms of the quality. Just for example, conventionally raised steak might have an omega-6/3 ratio, which omega-6 tends to be inflammatory, omega-3 is anti-inflammatory. Conventionally raised meat might have a ratio of 16:1. We want it to be 1:1. Whereas something that is raised either organically or regenerative, it might be 2:1, 3:1, 1:1. It's a lot closer to what we want that message to be. Again, with that ecosystem, what's the message that we're sending? Things that are very specifically prebiotic or probiotic foods. So you can look at this list. These I like to think of as really good fuel for beneficial bacteria. So onions, garlic, you can see that whole list. Cabbage, I particularly like to call out because cabbage in and of itself is high in L-glutamine. This is an amino acid that is healing for the cells of the gut lining. So that can be very helpful in any way. Cooked, sauteed, roasted, raw, in a soup, however you can get it in, it's still good. And then we'll talk about flax seeds in a bit. And then there are probiotic foods. So things that already have the bacteria in them. The only thing that I would call out about these is I would advocate for diversity of things. And I'm going to table that diversity thought for a few more slides. But I would not eat the same probiotic food every day. To continue here in a few slides. Cruciferous veggies. Everybody loves to talk about kale. Kale is only one of many wonderful cruciferous vegetables. I really encourage you to explore the whole family. They each have sort of their own potential benefits. Things like broccoli sprouts, those tend to be higher in sulforaphane, but they all can be very beneficial for the microbiome. And here's another little plug for eating more cabbage. It increases lactobacilli, it's good for blood sugar, and it's GI healing. The other pretty remarkable thing for me to think about is what we're eating. So this idea that our gut bacteria, so glucosinolates, these are the things in cruciferous vegetables that have anti-cancer properties. It is our gut bacteria that activate them. So by treating the gut, then when we're eating certain foods, we can help to access a lot of those anti-cancer compounds. And we'll talk about polyphenols a little bit as well. But again, by treating our gut, by consuming things that are supporting the gut, we will actually get more anti-cancer compounds from the food we eat. Legumes. We saw that legumes are very high in fiber, so this can be something that can be a really good way to kind of get in those grams. Soy as well. Some of the isoflavones in soy can also be very helpful for gut bacteria. These I'm just going to go through quickly because you'll get the PDF, but I really advocate for lots of different nuts and seeds because they're different fibers. They also have some anti-inflammatory aspects to them. You can add them to things. They're an easy way to get protein and fiber. And here's a few ways to get them in. Ground flax. So more of a note, specifically calling out flax. It's a great source of soluble and insoluble fiber. It's anti-inflammatory. Flax also binds up excess estrogen in the gut. So this can be very supportive for what we call the microbiome or an estrogen metabolism in the gut. And it also, any fiber is going to bind up toxin in the gut as well. So here's a whole list of nuts and seeds, also great source of fiber, protein, healthy fats. Green tea. I think about green tea as a food more than a supplement. Because especially when you're eating matcha, you're actually eating green, same as you would your salad. So green tea can stimulate beneficial bacteria. It inhibits bad bacteria or pathogenic bacteria. This can help to control for some of that tendency towards dysbiosis. And it also decreases inflammation. So you're starting to hear this mantra, things that decrease inflammation, things that help to heal the gut lining. Ways to get green tea in your diet, matcha powder in teas, smoothies. If you're not a big fan of green tea, that's okay. Just try a couple different flavors of it. There's green tea with tropical fruit in it. There's green tea cinnamon, add a slice of ginger. You can also add matcha powder in cooking. You're still gonna get the polyphenols. So green tea hopefully is your friend from. Due to caffeine though, if you are drinking green tea before 2 p.m. is best, because I don't want to disrupt your sleep. And then if green tea doesn't settle so well for you, add a little bit of ginger to it. Green tea is very cold and astringent in terms of the temperature and energetics of it, and a little bit of ginger helps. And then here's a list of the high polyphenol types of green tea, and it's those specific polyphenols that have the anti-cancer properties, but also it's the gut bacteria that give us access to these polyphenols. So you can see this list there as well. Mushrooms. So again, increases those beneficial microflora, balances the immune system in the gut, and it can help to heal the intestinal tissue area, especially around any kind of treatment. Chemotherapy, radiation, even stress around surgery can disturb that gut lining. And so we want things that are going to help to heal that lining. I put the medicinal mushrooms on here, but honestly, you can get so much benefit from culinary mushrooms. So there's a list there. Always cooked, not raw. Raw mushrooms, there's always a chance that they could be irritating to the liver. And mushrooms in supplement form can be irritating to the liver potentially as well. Many supplements can in the right instance. So I typically recommend only using the medicinal forms if you're working with a practitioner. Or sometimes reishi in tea form because it's more mild. So earlier I was talking about diversity. So diversity in the diet, what does that mean? So there was a study that was done a couple years ago where they actually showed that if people were having 30 plus plants per week, different plants in their diet, that they actually had a significant benefit to their immune parameters. So they were looking at some of the cytokines, anti-cancer messengers, things like that. So we want to aim for 30 different plants a week. And what we also found by looking at that is that it was more beneficial to the gut bacteria as well. One of the other things that's come out is that this diversity in gut bacteria can dictate whether a person responds to treatment or not. It's actually some very, and again, it's a bit of a tip of the iceberg right now, but there's a lot of very compelling research coming out looking at the profile of the gut bacteria and whether a person responds to immunotherapy or not. So we've been talking about, okay, the seat of the immune system is in the gut. Okay, we're giving immunotherapy, which takes the brakes off of the immune system. I think it's a natural connection to make. One of the studies I looked at was on radiation and somebody treated with antibiotics. They actually found that this particular antibiotic actually improved a person's response to radiation, colon cancer, because it actually knocked down some of the pathogenic or bad bacteria, and that person was able to heal much better from their treatment. So I mention these things because I want to really validate that when you do these things in your everyday life, you really focus on healing this center of ourselves, that not only can you feel better and have better immune function, but you may respond differently to your treatment as well, in a good way. On the flip side of that, dysbiosis can induce resistance to treatment. This particular study was on colon cancer. We're looking at dietary intake and patients that had more fiber, more short-chain fatty acids, actually had decreased progression of disease. So significant. More studies here linking dysbiosis to breast cancer, and they've actually delineated some of these bacteria that actually can produce beneficial anti-cancer metabolites. There's some stool testing that you can do to actually look at some of these ratios and look at the whole breakdown. There's many different tests out there. I have one that I use because I used it, for many years and I'm familiar with it. But this is something that I think that everyone at some point, hopefully in cancer treatment and healing after treatment, will start to do, so that we can really understand the specifics and have empirical data of what's happening in that as well. So I'm a little bit analog, all right? I'm a big fan of a checklist, okay? There are some really great apps too, so feel free to go for it. But I ask that my patients print this out, put it on their fridge, and see how many different things you can get in a week. Things that I want to call out is that, herbs count, spices count. So before you know it, you're getting a lot of these different things in. And remember that romaine lettuce only counts once. So this is 30 different plants. So this really helps us to get out of our patterns and to branch out. If you always buy regular hummus, try a white bean or edamame, something like that. It can be that simple. Use a different green. If you like spinach in your eggs, try arugula, try kale, try broccoli sprouts. So let's get a little bit to the herbs. So culinary herbs, even though these are separated right here as culinary and medicinal, a lot of culinary herbs have medicinal properties to them. So by increasing some of these in what we're taking in, parsley's got astaxanthin lutein in it. Sage can have antimicrobial properties. So can thyme for pathogenic bacteria in the gut. Same thing with rosemary. So increasing these herbs on a daily basis can really help with that balance. And because you're not taking a highly concentrated, I'm going to take this capsule of oregano oil because I really want to wipe something out short term, that's okay. But if you're taking some of these things in on a daily basis, I also advocate growing some of them yourself, then you're going to get that balance every day. You're going to get that message to the ecosystem every day. There's been some nice studies on a few of the medicinal herbs increasing butyrate. Butyrate was that short-chain fatty acid that we were talking about that can be so beneficial in terms of those immune cytokines or messengers circulating in the body. So how do we get them in? Grow them yourself, buy them. I'm a big advocate for farmers markets because then you're actually supporting local. You tend to have more of a relationship with what you're taking in as well, and store them in the fridge. So if you're buying fresh herbs, you can stick them in water, you can wrap them in paper towel, but they can last for a long time. Here's a tea. You can have all of these things in one tea, or you can kind of take some of these things out and decide which one tastes or feels better for you. And you can look at these in detail, but I want to call out a few things. So Tulsi is one of those, so that's holy basil. This is actually pretty easy to find in tea bag form. There's a couple nice brands out there. This one covers a lot of bases, just in terms of blood sugar support, immune. It does have some hormone balance, stress hormone support. Dandelion leaves, a great diuretic, also really good for liver function as well. Turmeric we talked about. Specific to the GI healing, not just anti-inflammatory or microbiome support, marshmallow root. Marshmallow root also has some prebiotic as well. And it's good fuel for those microbiota, so those bugs in the gut. Lemon balm has been shown to increase short-chain fatty acids. So again, those are some nice messengers to the immune system. The nice thing about lemon balm is it grows very well in the Central Coast. Plant it once, never have to plant it again. Share it with your friends. You can have it fresh or dried. Lemongrass is also wonderful, grows wonderfully here as well. It's an antispasmodic for the gut. And this is one of those balancers that can decrease some of those, I'm calling them pathogenic. These are the bad bacteria. These are the bacteria that can be inflammatory or that can cause some negative issues in the gut. How do you do the tea? Aim for 1 to 3 teaspoons, steep in 2 cups boiled water for 15 minutes. I like to do it with the lid on because then you're able to capture a lot of the essential oils that are in some of those herbs and get the full benefit. Strain and sip. Earlier in the day is better if it's a diuretic herb like that. Slippery elm. So you're probably all familiar with slippery elm lozenges. You know, they're fisherman's friend or something like that. Slippery elm you can get in capsule or in powder form. I really like this herb for healing the gut lining after treatment. And a lot of times during treatment too, if there's either constipation or diarrhea. It's known as a demulcent in herbal medicine. So this is very soothing to the entire tube from top to bottom. And it can be helpful with mouth sores, any heartburn, IBS. It's also a prebiotic. So it helps to produce those short-chain fatty acids. It'll be helpful for the immune system. Slippery elm is just that. It's slippery. So if you buy it in powder form, you mix it with a little bit of warm water and you drink it right away. Don't wait, or else you will find out just how slippery it is. So that's a little tip for you. But this is an amazing herb. I put olive oil in the botanical or in the herb section because olive oil, when chosen correctly in terms of the type of olive oil, is really a medicine. There are anti-growth polyphenols that can be helpful for blood sugar. Olive oil can have anti-cancer properties. Some people have really looked at potentially the reason why the Mediterranean diet is so beneficial is there's so much olive oil in it. People just get a lot of those polyphenols. But let's dig in a little bit. What does this do to the gut bacteria and that microbiome? Again, reduces, we're starting to hear this mantra here, reduces pathogenic bacteria, bad bacteria, stimulates growth of good bacteria, improves that GI mucosa lining, decreases intestinal injury. Oh, and look, it increases short-chain fatty acids as well. And there is some research about how it can modulate some of the oncogenes. So those are some of the genes that can either turn on or off oncogenic or cancer behavior growth patterns. How do you find good olive oil? Very lucky here. I always say buy organic if you don't know the farm, but you can ask about the farm. It should have a harvest on date. If you're buying it from the farmer, they'll be happy to tell you. Colored glass. Here's a whole list of high polyphenol varieties. So you can take a look at those, and a lot of times there'll be a blend, and that doesn't necessarily mean that it's bad, but a lot of times, if somebody's really taking the time to grow these in a way that are going to give us the most benefits, they're going to want to take the variety. So a lot of the blends are fine for cooking. You know, you put a little bit in the pan and you cook up your eggs and greens. But if you're really using it as a medicine, a drizzle on top of things, not cooked, I get specific on the variety. One of the biggest things too with choosing olive oil is there's less specified residue, which can of course affect our microbiome. As a side benefit, it's 26% higher in those anti-cancer polyphenols as well. So here's a little, I don't work for any of these people, but I love olive oil and I ask a lot of questions. And we're so lucky here in our area because there's, and if I've forgotten somebody that you know that grows really great, has olive trees and has really great oil, please let me know because I'm happy to put it on this list. But we have some really nice farms in our area that are very conscious. A lot of them test for polyphenol content. So you can actually, and you really want a polyphenol content that's at least above 500. And I'll usually have that on there, but if you are going to somebody who tests, you want it above 500. Speaking of polyphenols, please do not write down everything on this. The reason why I put this on here is because when you're thinking about anti-cancer foods, okay, everybody goes, oh, it's full of polyphenols. What are polyphenols? And why do we care? Well, in this instance tonight, I care because it's our gut bacteria that give us access to these polyphenols. And so these anti-cancer compounds that are in foods are really only going to be activated if we've got healthy gut flora. Okay, so you can ponder these, or if you're having insomnia, you can read them at night. But I just want to give a shout out to what they are and why it's incredibly important to support that gut bacteria. Just because there's so many wonderful ones here, I'll give a little shout out to quercetin. All right, so just a few kind of practical ways to get some of this in. I'm a big fan of eggs and greens plus olive oil, so as colorful as you can get it. So just some ideas there, some good little few recipes for you here, just for kicks. One of the things that I counsel my patients about is deep listening to your body. So often we're busy, you're like, I had a handful of pecans and a cucumber for lunch. Yeah, okay, that's some fiber. This is really advocating for us to slow down a little bit as much as we can and listen to our body. After a meal check-in, how are you feeling? Are you feeling nourished? The two signs of food sensitivity are brain fog or GI symptoms. So food sensitivities can be neurological or they can be GI. We typically think of them as GI, but they can also be neurological. When you are eating a food that you are sensitive to, this is going to be inflammatory to the gut. You know, so by listening to your body, often we kind of know what doesn't work, you know, and that's okay. If you know what doesn't work for you, follow the 90-10 rule. 90% of the time, try to do what we're talking about here tonight. The other 10% of the time, just have exactly what. Have the tomatoes with the sausage and the bread and everything. You know, maybe keep a little, you know, slippery elm by the bedside, or maybe something a little stronger. But have a big smile on your face, because a lot of that joy, or what I like to call, it's behind there, food joy, and getting into a food and having a smile on your face about it is really important too. When we're too restrictive, I always tell patients, suffering is not good for the immune system. So if we can avoid that by being too restrictive, and this is in reality, if you have food joy from chocolate cake, don't have it every day. And practice mindfulness when we're eating. What foods make you feel really good? Usually we know. So let's think about what we can do after tonight. Breathing practice daily, like we did at the beginning, relieves stress and support digestion. This also strengthens our parasympathetic nervous system, which is our healing response, or our relaxation response. Move your body. Improving circulation is extremely helpful for the microbiome. Get out in nature. There's wonderful studies about forest bathing, increasing natural killer cells. Limit antibiotics, pesticides, herbicides, and preservatives. These all kind of adversely affect the microbiome. Antibiotics are wonderful drugs. I am not against them, but be mindful about when you need them. Practice good sleep. Get off the tech and wind down. Drink some green tea. Increase your prebiotic foods, mainly from fiber. Eat more plants. So when you are looking for that breathing practice, a lot of times we can get hung up with a perfect picture about a breathing practice. Everybody said to me, I'm not a very good meditator. Nobody is, turns out. So that's why we have to do it. We have a hamster in there. We have on our brain. Okay, so we just have to corral it into that relaxation response. It's most important to be consistent with a practice. If that means just sitting outside, or let me reframe. I don't want to say just. If that means sitting outside in your garden, doing ideally 20 minutes of breathing practice a day, you don't have to be doing it the whole time. It could be sitting on a bench. It could be after you go for a walk. It could be at a stoplight 10 times a day. I always end up sounding like a Nike ad. So just do it. It wants to come out of my mouth. But talking about it and worrying about it, all of this counts. Sitting with your dog, petting your dog, doing that inhale belly out, exhale belly in, it all counts. Here's a little plug for the Dirty Dozen. So we talked about how pesticides and herbicides can affect the microbiome adversely. So they do one of these every year. You can go to ewg.org. It basically looks at what you buy organic all the time if you can, but if you can't, follow the Dirty Dozen and avoid the ones that have the most risk. Here's some references. Oh.